Quetiapine is one of the medications that can be used to treat a few mental disorders in your brain. It is well known by its brand name, Seroquel. It can be given to you to treat psychotic disorders like schizophrenia. This medication works on your brain to modify the activity of a few chemical mediators, and it restores the balance in your brain that relieves psychotic symptoms. Quetiapine is classified as an atypical antipsychotic. That means this medication works in different ways. It may have multiple clinical uses. It can have less troublesome side effects compared with old-generation typical antipsychotics. It can also be given to control the mood swings in bipolar disorder. This medication can control the sudden episodes of mania or depression in people with bipolar disorder. Apart from these clinical uses, this medication can also be given to you for a few other conditions. Quetiapine can induce sleep. Therefore, it can be used to treat insomnia. It can also be used to control symptoms of alcohol dependence, where it can reduce aggressiveness and agitation. However, for these two conditions, it is used as off-label. That means even though not approved, it can be used in these conditions due to its beneficial effects in these two conditions. In this way, this medication has multiple clinical uses. In this video, we are going to discuss essential things that are required to know before use of quetiapine, like how this medication works, how to take this medication, and what are the important precautions and side effects. How to take this medication. Quetiapine is available as a tablet in two formats: immediate-release tablets as well as extended-release tablets. In the form of immediate-release tablets, it is available in different strengths starting from 25 mg to 400 mg, whereas in the extended-release tablets, it is available from 50 mg to 400 mg. From the extended-release tablets, the drug is slowly released and uniformly distributed throughout the day. Therefore, these tablets are intended to be taken only once a day. The doses are based on your medical condition, other medications you're going to take, and the response to this medication. In order to avoid troublesome side effects, this medication should be started at a very low dose, and the dose can be gradually increased as your body tries to adjust to this medication. Take this medication regularly at the same time for a better therapeutic response. Remember that it takes some time to improve your symptoms. Therefore, never try to take higher doses in the absence of any improvement in symptoms. How many times this medication is given depends on for which purpose it is going to be indicated. If you are using quetiapine for treatment of psychotic symptoms, it may be given either once or twice a day. However, when it is indicated for insomnia or for the treatment of alcohol dependence, it is usually given once daily at bedtime. For the treatment of schizophrenia, quetiapine is given to you at a lower dose on the first day. In the case of immediate-release tablets, on the first day, they can be given as 50 mg per day in divided doses. In the case of extended-release tablets, initially it is given 300 mg per day. From the second day onwards, the dose may be increased to reach a daily target dose of 300 to 400 mg. For treating insomnia and alcohol dependence, quetiapine is given at lower doses. For treating insomnia, it can be started at 25 mg per day, given at bedtime. Similarly, for treatment of alcohol dependence, the dose may be variable from 25 to 50 mg. How it works. Quetiapine is an atypical antipsychotic. It is related to another medication called clozapine. This medication can relieve positive as well as negative symptoms of psychotic disorders. It works by multiple mechanisms on your brain. One of the chemical mediators, dopamine, is playing a key role in the induction of psychotic symptoms, and quetiapine blocks dopamine D1 and D2 receptors in your brain. However, being an atypical antipsychotic, this medication can also block other types of receptors. Among these, serotonin is one of the important chemical mediators, which is also involved in the induction of psychotic symptoms. Quetiapine can block the 5-HT1A and 5-HT2 receptors that may also result in antipsychotic action. Apart from these actions, this medication can also block a few other receptors, which may result in a few other actions. It can block the histamine H1 receptor that may lead to sedation, and it can also block alpha-1 adrenergic receptors leading to hypotension. Effect on glucose levels. Quetiapine can increase your blood glucose levels. Therefore, carefully monitor for any symptoms of hyperglycemia, like excessive thirst, increased appetite, weakness, and excessive urination. Therefore, regularly monitor your blood glucose levels while taking quetiapine. This hyperglycemia is more pronounced in people with diabetes or risk factors for developing diabetes. Quetiapine can also increase your lipid levels. Triglyceride levels may be increased with the use of quetiapine. It can also increase your total cholesterol levels. Therefore, before starting the therapy, check your fasting lipid levels and monitor your lipid levels at regular intervals on long-term use. Will it affect your blood pressure? This medication can reduce your blood pressure when you change your posture. This condition is called orthostatic hypotension or postural hypotension. Therefore, while changing your posture, either from sitting to standing or standing to lying, you may experience a drop in blood pressure. However, this orthostatic hypotension is more pronounced in a few people with other risk factors. If you have dehydration or are using any other antihypertensive medications, this orthostatic hypertension may be more pronounced. Even this effect can be more common in elders. It can also show a quite opposite effect on your blood pressure. It can also elevate your blood pressure, especially your diastolic blood pressure. This rise in blood pressure is more specifically observed in children. Effect on body weight. Quetiapine can increase your body weight. Therefore, monitor your body weight while using quetiapine for longer periods. The action of this medication on body weight may be related to a chemical mediator called serotonin. As quetiapine modifies the transmission of this chemical in your brain, your appetite may be elevated. This results in weight gain. Try to avoid intake of high-calorie foods when you observe an elevation in your body weight. Use in dementia. Quetiapine may not be suitable for you if you have dementia. It is not indicated for treating dementia in people. However, in a few people, dementia may be associated with psychotic symptoms. In such people, this medication should not be used to treat psychotic symptoms, because this may increase the risk of cerebrovascular complications resulting in the risk of stroke and death in people. Effect on attention. Quetiapine can produce sleepiness. It can also produce motor disturbances. Therefore, you may have a risk of falls. This medication can block a few adrenergic receptors on the blood vessels. Normally, alpha-1 adrenergic receptors are located on the blood vessels, which are responsible for contraction of the blood vessels. Quetiapine blocks these receptors, thereby reducing the contraction. This results in the dilation of your blood vessels, leading to hypotension. Neuroleptic malignant syndrome. Just like many of the antipsychotics, quetiapine is also associated with neuroleptic malignant syndrome. It is a condition of elevated temperature with muscle rigidity, muscle incoordination, confusion, and irregular heartbeats. Even though rare, this medication may produce neuroleptic malignant syndrome. So if you observe any unexpected rise in your body temperature along with muscle contractions, immediately report to your doctor. Risk of infections. Quetiapine can reduce your blood counts. This condition is called agranulocytosis. It can reduce the neutrophils, which may result in an increased risk of infections. Even it can reduce red blood cells, leading to anemic conditions. Side effects. Quetiapine can produce dizziness and lightheadedness. You may feel dizzy and lightheaded, particularly during the first few days of treatment. So during the early days of treatment, get up slowly when you're rising from a sitting or lying position to avoid the risk of falling. It can also increase the sleepiness. Therefore, you should be cautious while driving vehicles. It can also increase your diastolic blood pressure. You may have a lack of energy. Other side effects like constipation, dry mouth, and headaches can also be observed. It also increases your appetite, which may result in the weight gain. You may also have abdominal pain, indigestion, tremors, and back pain. In a few people, it can produce blurred vision and cold-like symptoms. These are the essential things that you should know before taking quetiapine. That's all about this week's story. Thanks for watching this video, and if you find any interesting facts on this medication, please share them in the comment box below. Please do subscribe and hit the like button. I will come with another interesting video in the next week. Until then, have a nice time, take care, and goodbye.